So, an affordability program allows a patient to actually start therapy and stay on therapy because it's offering them financial assistance. I'm Ticia Cawley, Vice President, Client Solutions at ConnectiveRx. I have been with ConnectiveRx for over 12 years. My area of responsibility and expertise is in specialty products and programs with a focus on our affordability for specialty products. I would say there's two big differences between specialty medications and retail medications. One is that specialty medications are often covered under medical benefits. That changes the cost structure quite a bit. And number two, specialty medications, especially those infusion drugs and those injectable products, are usually much more expensive. If you just think about the patient journey, right, from the time the drug is prescribed to getting on therapy. So, number one is making the patient aware of the fact that this program exists. That's huge, and there are a number of ways that that can be accomplished. It can be hard written material. It can be websites. It can be text messaging. Mobile apps, any number of ways, but that's critical. Making sure that all of the key stakeholders know that the program is available. Then number two, making sure that whoever is actually doing the billing has the appropriate information. Traditionally, that is accomplished through a copay card, especially in today's COVID world. That copay card usually has air quotes around it because we're using virtual techniques. But the important thing is that the pharmacy or the healthcare provider who is actually billing both the payer and the copay program have the appropriate adjudication information so that we at ConnectiveRx can actually process that claim and make sure that the payment goes to the proper entity. So that's the benefit to the patient. The benefit to the prescriber is that he or she would have a level of comfort that the actual product that they're prescribing, that they have decided is the best for the patient, is going to be able to be acquired by the patient. Knowing that there is some financial assistance there gives the prescriber, again, a level of comfort that he's not going to get a lot of calls from the pharmacy, and that the patient is going to be able to start therapy. And we can also consider the brand or the manufacturer. So the benefit to the manufacturer is the fact that yes, they are covering some of the cost of the patient's out of pocket, but because the patient is now able to afford the drug and the prescriber is now feeling comfortable about prescribing the drug and feeling assurance that the patient is going to be able to stay on therapy, then that's going to help the number of scripts that are actually written for the brand. So it's really threefold, right? The patient benefits, the prescriber benefits, and the brand benefits.